Brighthope, a friend of us all. Thank you both for being with us today. Gigi, you've been on the phone to reporters all day around this budget. What are you reporting? What are they asking you? Where do we stand?
Generally, people are asking first, what's in this budget for me, or what's in this budget for different parts of the economy or different sectors of the population? Is this an election budget? Which of course it is. And what else would you have liked to have seen? Those are usually the kinds of questions that you get. Sometimes people have a very narrow approach, for example, focusing on the tax reform side or angle. For example, there was one series of questions that was all about bracket creep. How bad is bracket creep? Is bracket creep a problem for cost of living? Are we ever going to address bracket creep, et cetera, et cetera? And so this is an example of just very narrowly focusing on one particular issue. My response in general to the budget has been that we see in it the types of initiatives that we've seen in recent budgets, which essentially boil down to a lot of cash splashes on a lot of silly things and things that are intended to be politically popular, things that sound good. So, whenever you can say you're supporting women or aged care workers or child care or something, it makes you're wrapping yourself in a beautiful flag. But if you look at the actual predicted impact by anyone objectively observing what these policies do on the welfare of the people being served in those sectors, or the working conditions in those sectors, or the experiences of those using the services, I don't really see it's going to move the dial very much. I do think it's nice to have some more coverage for some of the women's health stuff. I actually do support the increased funding for GPs, and certainly the increased incentives for doctors to become GPs, because GPs are one of the few things in our healthcare system at the moment that actually, I think, do provide some actual health services, some good positive benefits to people's health. But in general, I see a lot of basic support handouts to lots of different groups and across lots of different categories, from HECS debt erasure to helping the co-ownership of a house with the government, to helping people with their energy bills, etc., which aren't really addressing the core structural problems of Australia, which we can talk about. There's a number of them I'd like to see better addressed.
What about from Ian? What about from a health perspective? Have you had any takes from this budget?
Yes, look, I agree with Gigi with regard to primary care. Absolutely, we need more doctors in primary care, and we need better doctors in primary care. We need better training. And my issue about all of these budgets, including this one, is that there's no money going into training doctors into how to make people healthy again and stop the revolving door syndrome of people going in and out of hospital, people going in and out of clinics, retaining the same illness and disease that they've started with, and nothing being done about it. That's a massive drain on the budget. The other thing is we're making, and I'm going to be controversial here, Russell, we're making children sick. We're creating the sickness in the children, and these children are ending up in NDIS, and that's going to break the bank as far as I'm concerned. I don't know if Gigi agrees, but we're going to be spending about $30 billion. It's going to be the greatest expense in healthcare, so-called healthcare, coming up into the next decade. So I really think we should start examining quite closely what we're doing to making these children sick with autism on the autism spectrum and neurophysiological disorders. And I blame the over-vaccination of the population and the overuse of antibiotics, especially in infancy. And I mentioned a number of times that we are the greatest prescribers of antibiotics in the world.
That's true.
To infants under the age of 12 months. Unbelievable what we're doing to the health of our children. And I think we have to be very cautious about the training of doctors, because they are being brainwashed completely that these vaccination programs are for the benefit of the individual. They're not, and they're not for the benefit of the herd, the population either. Public health policies need to change dramatically. And we need to start looking at the health of the individuals. And I mean, Gigi and I have had some good talks about this sort of thing in the past, but I'm very bullish about it at the moment, because I can't see any change in real healthcare for the next generation. And we need to see a couple of generations of change in healthcare to actually swing us around and get us away from this chronic disease paradigm.
Gigi, has there been any thing that you've seen where Australians are becoming more aware of their personal responsibility for their own health?
That's an interesting question. I do agree, of course. Let me just say first with Ian about the increasing epidemic of morbidity and indeed mortality. We've lost tens of thousands more Australians than we should have since mid-2021. As people will know probably from listening to past guests on your program, but also if you just go to the Senate inquiry and look at the submissions, there's quite a number of really good submissions that document the excess deaths and ponder aloud exactly what the Department of Health should be pondering, which is why are we losing these people? And if there are that many excess deaths, they would probably also have people who are sick and more sick than they should be. And where is that sickness coming from? That's what the Department of Health should be worried about. On the question of whether people are still looking to the government to solve their health problems, I mean, I'm afraid that in the bulk of cases they are. Yes, I do think we had a little chat before going on air. Russell, about whether you look after yourself and whatnot. I've always tried to prioritize that because having had a few nasty experiences myself with the kind of institutionalized allopathic medical system, I've learned that sometimes it can be useful if you, for example, have broken a bone or if you really, really need antibiotics for something. And there are a few other reasons you might want it. But in the main, in order to retain health and promote your own health, you actually don't really need the system we've established and labeled as health. What you need is good diet, excellent sleep, plenty of water that's clean, clean air, water, etc., exercise, and good social relations, and a purpose in life, for mental health. So there are things that we don't usually put the label health on, or at least money doesn't flow into those areas from the government's pockets that, essentially is called health and that we all think about health. But those are the things that are most important in maintaining everyday health. And indeed, the visits to the GPs that we were talking about earlier, I think can be used as a vehicle to increase people's sense of responsibility for that side of their lives, I suppose, which it doesn't include setting your own broken bones, but it certainly should include making sure that you've got enough vitamins and minerals, that you are getting enough sleep, and so forth. So yes, I totally agree with Ian. We need a structural change in the way health is delivered. And if people are interested in some details about what I and my co-authors on the Great COVID Panic think, we blogged about this exact issue on Brownstone Institute a couple of years ago. I think the title was something like, "Is there a cure for the Western public health catastrophe?"
Well, I'm not going to tell you about my private health concerns in the future, Gigi, because you're going to bring them up and throw them on the program. But we could all do better when looking after ourselves. We tend to go to great lengths to look after other people. And I know that there are people come to both of you asking for help, and how can they manage their way through. What could government do? Question to both of you: what could government do tomorrow to say, righto, we're going to admit that Australia is less healthy today than it was 10 years ago or 15 years ago or 20 years ago? And if I go back 50 years, I grew up in a small town that would have had one obese person in the whole town. One. And all the food came from within 10 k's of that town that we ate, and it was seasonal. So is it just food? Is it lifestyle? Is it we're too busy or two parents working? What is it?
Ian, do you want to go first as the MD in the room?
Thanks, Gigi. Look, I agree with everything Gigi said, but there's one thing you missed out, Gigi, and that's sunshine. And there's just been another paper published on what vitamin D. There's many things that sunshine does, but vitamin D is one of the things that builds us up. There's a paper just been published recently on vitamin D and how it protects us against so many of the diseases, autoimmune diseases, inflammatory disorders, some cancers, degenerative diseases, right across the board, not just infectious diseases. So we need 15, 20 minutes of sunlight, perhaps once or twice a day, over a significant part of our body, because just taking a capsule or tablet of vitamin D is not enough. So we've got to get outside, and that's very, very important to get that fresh air as well. But Gigi, I'm going to ask you for a lot of money to do a couple of things in the health department. Okay.
You're going to ask me for money. Where am I going to get this money from?
We'll get you the money, Gigi. Don't you worry about it.
I'm very confident that we're going to turn this thing around if we keep talking and changing people's attitudes and educating people. That's another part of the problem. But Russell, I think most importantly, we need to retrain our medical and healthcare professionals so that we have a significant percentage of them not treating disease, but actually taking patients from the disease care system and making them healthy.
But
And also
have doctors that want to do that.
Yeah, there are doctors who love doing it, and they get great benefit from seeing patients who are actually cured from some of these autoimmune diseases and cancers that are almost impossible to treat. And they love doing it, but they're far and few between, and they are threatened by the current system that if they step out and do abnormal tests or too many long consultations, or if they refer somebody for example, who've got one of these turbo cancers for ivermectin and fenbendazole and membendazole, these repurposed medicines, they are risking their medical license. They're risking their future. And this is another thing that's really holding medicine and healthcare back in this country. The medical boards and AHPRA, the regulators, are strangulating our doctors and are actually contributing to more disease and not actually looking in the best interests of the public, which is what they should be doing. So, and the medical schools need reforming. I've got a letter to go off to my medical school about how disgusted I am with their behaviour in respect to taking money from a commercial entity that is making profit out of something that's possibly one of the most dangerous drugs that's ever been created. And that drug is, of course, the messenger RNA packaged up in the lipid nanoparticle. So we do need to see some significant systemic changes. And I'll leave this up to Gigi because a stitch in time saves 9, doesn't it?
Yeah, Gigi, how do you turn the ship around?
Well, not easy. Obviously, I will first start by agreeing again with Ian about the vitamin D. The only reason I didn't mention that is because when I go for my runs, I'm always out in the sun. So I sort of take care of, killing a bird with a stone there. But totally agreed. And I think that's probably, underemphasized definitely underemphasized in our health education. We do have health education in schools, of course, and PDHPE or whatever, but we could do a lot better to empower young people in terms of maintaining their best health through things like drinking water rather than soda pop, drinking, healthy beverages if they are going to have something other than water, and eating well. We can, change cafeteria lunches to have an emphasis on good quality food. Same thing for hospitals. I think there are things that can be done reasonably quickly. I mean, you could, for example, this is radical, but you could, for example, take the WHO list of essential medicines from before COVID, before it became corrupted by the inclusion of some medicines whose names shall not be mentioned, and look at that 2019 list and say that these are the things we want to enable anybody to get at the local level, community level, and we want to empower nurses. Doesn't even have to be doctors, but reasonably trained nurses. And I won't get into well, how much do they need to be trained? Is it a registered nurse? Is it this kind of nurse? Whatever nurse who can come into your house and essentially just say, okay, here are some fact sheets on lifestyle and basic needs, and I can do a brief assessment on how healthy you are without you having to necessarily wait until you're so sick that you pick up the phone and go to the doctor and then have to do, rather than prevention, some kind of extremely expensive cure, or just backfill on your own prevention and be a lot sicker and lose more days of work and all that sort of thing. So I think that's the kind of...
Where does exercise come into this?
Oh, I think exercise is phenomenally important. I'm a marathon runner, as you know, Russell. And I don't run a lot of marathons, but I run a lot. And I do think that everybody has their own preferred way of exercising. And, it's obviously part of maintaining health. I mean, that's very clear. And actually, Australia has an advantage in the sporting arena relative to a lot of peer nations because we have such a strong history in this, right? Our per capita medals count from the Olympics is sky high, right? We're like Don Bradman, right? So we should capitalize on that, right? We should say this is about health, and we should encourage that kind of sporting spirit to continue. And we do it better, way better than the United States, which I come from. So I'm very proud of that. I think that's a wonderful feature, but we don't probably emphasize enough the connection of that to actual health. But all of these things are better done at the community level. And what I'm seeing right around the corner here, I don't know if you guys have visited new UNSW, which is right where I live. There's a new hospital coming up, an acute care facility, right, which is supposed to be a teaching hospital, as Prince of Wales, acute care facility. You walk by it, it looks like a Stalinist, communist realist kind of architected thing. It's this ginormous, gigantic building, which looks incredibly forbidding. I would not want to go in there. I mean, that is the place that you don't want to go, right? I never want to go there. I'm so happy I haven't had to go to the hospital for years, because it's a scary place. Now, that's not the way that we should have to feel, or the way we want to feel about seeking healthcare, right? We want to feel that it's actually safe and probably not going to make us sicker. But at the moment, the way that hospitals are run, there's a huge number of infections that are picked up at the hospital. There's a lot of medical mistakes that happen there. The incentives around compliance and ticking boxes and all sorts of stuff that isn't really about patient care are skewing the actual care received away from being good for the patient and towards being good for the staff. I don't know how people sleep at hospitals. My father-in-law is at the hospital right now. I mean, honestly, I don't know. There's so many beeps and whistles going off all the time. The lighting is bad. There's no outside access, to Ian's point about getting vitamin D. The nutrition on the plates every night is mediocre. So, there's just so many things to change.
Ian, what do you think about food being an issue in Australia?
Sorry, Russell, you were breaking up a little bit there. Can you repeat it?
The issue of food. Gigi just brought me to the point of nutrition in a hospital, anywhere else, nutrition. I see that the introduction of fast food outlets in Australia has caused enormous obesity across our society, which is an absolute disgrace for a sporting nation that we are.
Yeah. Well, I mean, I agree. The food is terrible. The supermarkets are pushing rubbish. Most of it's rubbish. Most of it, I've got a slide from my lectures and boxes falling off the shelves with, crap and rubbish written on them. It's just unbelievable what goes into it. Sugar is a poison. Take everybody off sugar and we will see a dramatic change in people's health over a period of time. Take everybody off seed oils, another one of these toxins that goes into our system, produces inflammation. Both of those upset our gut microbiome, and if the bacteria, the good guys in our stomach and intestines don't exist there, and we have the bad guys there, then we don't digest and absorb very well. We are producing toxins in the bowel that are absorbed back into the system, and we know that now that the toxins in the bowel are taken back up to the brain by the vagus nerve, which comes from the vein and goes down to the bowel. So we've got a sump inside our system that's not being emptied because of the blockages created by metabolic breakdown products from the foods that we're eating. We eat too much. I mean, I've got a list of things that I take people off: sugar, white flour products, alcohol, too much tea, coffee, chocolate, dairy foods in some cases, cereal grains in others, wheat and barley and rye and oats with all of the gluten that we're consuming that wear our guts out. The best things that to have are things like red meat, poultry, white meats, fish. Ideal, the best oils come from the fish. The omega-3s are the things that keep us young and healthy and feed our immune system. And we get the trace elements from all of these wonderful foods. Plus you have your vegetables and not too many sugars from fruits, but fruits are also important. Nuts are an important part of the diet for us as well. Nuts and seeds and whole grains that we're not reactive to. And this is why we talk about preventative, predictive and personalised medicine, because we don't give everybody the same thing. We take everybody off sugar and seed oils and a few other things I've mentioned. But individuality is a crucial factor in this. And this is why it's so important to have the doctors trained to think and act in terms of not just disease, but what's causing the disease. Looking for allergies, looking for deficiencies. I mean, I'm going back through some of my old lectures back in the 70s and 80s and looking at some of the things that Gladys Blocker was talking about in the National Institute in the US. She was talking about how important trace elements are. Zinc and copper and manganese and selenium. Selenium prevents a lot of cancers, and our diets are deficient in selenium. I mean, selenium was something I was very interested in when I was doing agricultural science, but human beings need it as well. We have the answers to many of our problems. They're answers that have been published, answers that are
If you
traditional.
could achieve one thing tomorrow, and you're speaking to the Prime Minister, what would you ask him to do in this case? It could be a female, but in this case, it's a male. Very quickly. Gigi.
Take our advice.
What's that?
I said, take our advice.
Yeah, but I mean, he's looking for one very easy thing. I would say suspend AHPRA's powers over the ability of doctors to prescribe or treat their patients, and have a formal external review of, how in fact that registration process should be managed or gatekept. Because I think if you actually got truly independent people, I mean, people who are not on the payroll of big pharma, people who have no experience with it, I mean, people like me, for example, or anybody else who has an ability to just logically analyze incentives and review that system, I think you could probably come up with a much better one. And in the meantime, you'd get people being able to be treated by doctors who were using their actual training rather than just being afraid of the bureaucratic overreach that might come to hit them if they made the wrong decision.
Thank you for that. Ian?
Oh, look, I can't disagree with Gigi on that one.
Take all our advice.
But we need freedom in medicine. We need to give the doctors the confidence to think critically about what they're doing. So once they're free to practice.
I'd like to thank you both for flying high on our behalf today, because you really are raising the bar on health issues for this nation. I think we're moving to a time when we can implement your dreams of what we might do in this country, and I'm going to be a big part of that. Thank you very much, both of you.
Thanks so much, Russell. I hope you are very successful.
Gigi Foster and Professor Ian Brighthope, thank you for being with us today.
Thanks,
Have a
Russell.
great day. Thank you.
Thanks for Gigi. Bye-bye.
Authorised by Russell Broadbent MP, Independent Federal Member for Monash, 46C, Albert Street, Warragul, Victoria 3820.